Okay, well, welcome colleagues. We've arrived at noon, so it's time to get underway for our Friday, May 7th edition of the COVID-19 situation report for our community. Thank you very much for joining us, and we will make our way through the latest statistics as we share the news and other changes that are evolving with the pandemic. Okay, so to start us off, we will take a moment to respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so let's begin with some opening remarks from our chair of the Board of Health. So I welcome Mayor Andy Mitchell. Please go ahead, Mayor Mitchell.
Thanks, Brittany. We are about to face a new challenge in the battle against COVID-19. As the third wave crests and begins to slowly recede, we need to decide how to respond. Unlike earlier in the pandemic, where we had little previous experience to draw from, this time we have lessons to be learned from waves 1 and 2. It will be important we learn from that experience. We need to follow the 3 Ps: patience, perseverance, performance. Patience. That the measures adopted be prudent and do not facilitate a reemergence of a new widespread outbreak. Perseverance. All of us need to continue practicing public health measures until the risk of transmission has been curtailed. Performance. We all need to be vaccinated, and when the time comes, to get our second dose. There are also lessons that governments need to act on. The 3 Cs: cooperate, correct, continue. Cooperate. Governments need to use their energies to fight COVID-19, not each other. There are lots of issues for governments to disagree about. I would prefer it not be ones that impact my health. Correct. Take the time to fight the systemic challenges identified by COVID, the safety of long-term care, protection of essential workers, domestic production of critical supplies, effective border controls. And continue. Provide ongoing support to people and businesses that have been adversely affected by the pandemic. Finally, as we enter into the summer and cases decline, we all need to return to some sense of normalcy. We need to focus on targeting behavior that creates a high risk of transmission and encourage safe outdoor activity that presents minimal risks. When it's time, we need to play again, safely. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, so to walk us through these slides, we now have Dr. Salvatierra joining us. So please go ahead, Dr. Salvatierra.
Thanks, Brittany. So as of 4:30 p.m. yesterday, we have 68 active cases in the Peterborough area. That's 7 fewer than we reported on Tuesday. Most of these continue to be variants of concern. However, the number of high-risk contacts has increased again to 216. That's up by about 23. And that's just in the last few days. So I certainly can't stress enough how important it is that we limit our contacts to household members only so that there are fewer potential exposures resulting from a positive case. Sadly, we are reporting another death of a Peterborough area resident. So you'll see that our local number of deaths now stands at 15. Next slide. We're showing you the weekly rates here, and you can see that so far this week, we are reporting 32 cases. Next slide, please. The number of active outbreaks in our community has decreased to 5, as shown on this slide, and that's 2 fewer than Tuesday. So that reflects that the Empress Gardens outbreak has resolved, and that we have also declared another workplace outbreak over as of yesterday. All other outbreaks remain stable. Next slide, please. Here I'm showing you the incidence rate, and again you'll see Peterborough in the purple line, and you'll see our neighbors Durham in yellow, Haliburton, Kawartha, Pine Ridge in pink, and Hastings, Prince Edward in green. So starting at the right-hand side of the slide, you can see that our weekly case incidence rate has decreased considerably from 61 cases per 100,000 last week to only 39 cases per 100,000 this week. It's also good to see that our neighboring health units are also seeing declines in their case incidence rate. But as you can see here, and as we've observed, Durham region continues to experience much higher rates than in our area, reinforcing the importance of limiting all travel except for essential purposes. Next slide, please. So here again, we're sharing with you the data from the treatment plant here in the city of Peterborough. And the blue line represents the raw data. The green line is the normalization of that data, just to account for variations in the actual sample. But if you look at both lines, they are, and the last few days, you can see that they are both showing an increase, which is very concerning, as what we have seen in the past, and if you look at the red line, which represents our active cases, the wastewater surveillance typically gives us about a 3 to 4 day notice. So anticipatory notice of increases or decreases in our active cases. So we may expect to see more cases emerging over the next few days. We'll certainly keep our eye on that. Thanks. Next slide, please. I'd like to share with you our latest dashboard on our vaccination rollout. And you'll see here that since last Thursday, we have vaccinated an additional 4,000 people, bringing our total up over 60,000. And of that, almost 56,000 are Peterborough area residents who have received at least their first dose. So we've increased that by about 3,600 in the past week. When you look at the pie chart, this is reflected there in that you'll see that our current vaccination coverage rate has increased to 45, just over 45% over last week. And that's about 3% more than we reported last Friday. So we expect this number to continue to grow considerably as more vaccines arrive in our community. When you look at the bar graph, that's representing the vaccination levels by age. And I know it's a little small here, but what you should be able to see is that we are now showing that about 75% of our residents who are 60 years of age and older have received at least 1 dose of the vaccine. So that's all very positive news. To continue on the topic of vaccination, the good news, or the more good news, is that eligibility continues to expand for more residents and for those of us who are not currently in a hot spot in the province. So yesterday we announced that there were 3 new groups that have become eligible to book an appointment. And those groups are people 50 years of age and over, people with high risk health conditions, and that includes conditions like obesity or people who are immunocompromised, either from medications or other treatments like chemotherapy, and people with intellectual or developmental disabilities such as Down syndrome. The third newly eligible group is the first group of essential workers who cannot work from home. And that includes teachers, school bus drivers, school custodial staff, as well as farm workers, enforcement workers, inspectors, and licensed childcare providers. For these groups, no proof is required when you come to be immunized, but you will be asked to attest to your status, your eligibility at the time of booking. Starting next week, we do anticipate that we will be able to open up eligibility further to include people who are 40 years of age or over, and those with at-risk health conditions. The list of at-risk health conditions is quite long, and it does include conditions such as diabetes, heart disease, dementia, liver disease, all other cancers, etc. The full list is available on the Ontario government's COVID-19 website. And again, you won't need to show proof at the time of immunization. And so you don't need to contact your physician. All you need to do is you need to attest at the time that you are making your booking. By the week of May 24th, all adults who are 18 years of age and older will be eligible to book an appointment for a COVID-19 vaccine. I would also like to clarify that currently the eligibility starts at the age of 18 years. So if you haven't turned 18 years yet, currently we are not able to immunize you at our mass immunization clinics. Many of you have likely heard the good news that Pfizer has now been approved by Health Canada for anyone 12 years of age and older, and plans are underway to extend vaccination clinics to our younger residents. So please stay tuned for more information. We should have something for you in the next week or two. We're looking forward to bigger and busier clinics in the coming weeks as both eligibility expands and our vaccine supply increases. Clinic appointments are booking up quickly. I understand that as of this morning, they are all gone. There weren't any available, but please be patient because we do expect to open up more appointments next week, starting Monday. So please check again Monday if you're looking for an appointment. Today, we are also announcing the launch of our standby vaccination list. Now that more people are eligible for vaccine, we're keen to promote this list because it helps us prevent any vaccine wastage by using up leftover doses at the end of the clinic day. The list is not a guaranteed way to get immunized, so please do book through the provincial system if you're eligible. But if you like, you can also sign up for this standby list. We limit it to 100 people, and so it opens up as space permits. You can sign up for it on our website by going to the page for vaccine clinics and looking for the big orange button that says standby list. To get on the standby list, you must be eligible for a vaccine and you must not have received your first dose already. So we are not using this for second doses. You must be available and reachable between the hours of 3 and 7 p.m. And that would be 7 days a week, because we will be moving back to 7 days a week delivery. And you have to be within 30 minutes drive of any of our vaccine clinics. Please avail yourself of that standby list if you're eager to get your immunization and help us out at the same time. But also check back regularly if the list is closed, as it will reopen when space becomes available. So thank you. In closing, I would also like to remind residents that our clinics are offering both the Moderna and the Pfizer vaccines. They are both very safe and effective messenger RNA vaccines. Please make sure to take advantage of the many resources that are out there to learn more about these vaccines if you have questions. We've had a few residents show up to our clinics and then walk away when they've learned that it was a Moderna vaccine, and I must admit, I find that extremely disappointing and hard to understand. So feel free to call the Provincial Vaccine Information Line at 1-888-999-6488 to have your questions answered, or you can watch the YouTube video of my presentation a few months ago explaining what mRNA vaccines are and how effective both the Pfizer and the Moderna are. Our website is another great source of information on these vaccines. So thank you, and over to you, Brittany.
Thank you very much, Dr. Salvatierra. And my colleague Sarah has put in the chat function a link to the standby list. So to our media guests or anybody, if you'd like to quickly see that, you can access it through that link. Okay, so now we have an opportunity to hear from our elected officials, and I see joining us here today we have Chief Carr from Hiawatha First Nation. And Chief Carr, if you have any comments, you're welcome to share them now, or if you'd like to just make yourself available for questions, that's certainly fine too. Did you want to share any remarks?
Hi, Brittany. I'll just stay on to the end if there's any questions. Thank you.
Okay, great. No problem at all. Thank you for being here. Okay, let's hear from let's see if the warden has been able to, I think he's had to leave. Okay, so just looking through the list, I see our Mayor, Diane Therrien, is here with us. So please go ahead, Mayor Therrien, if you've got some comments to share.
Hi, Brittany. Thank you very much. I don't have much to add aside from what the board chair has said and Dr. Salvatierra. I know that this weekend is Mother's Day and a lot of people are missing they're seeing their moms. But again, we have to be safe and vigilant and hang in there a little bit longer. And as Chair Mitchell said, be kind and stay safe. And I'll stay on for questions at the end. Thank you.
Brittany, are you on mute?
Sorry, my apologies, everyone. Okay, thank you very much, Mayor Therrien, for your comments. And let's move on to our media guests. So let's start today with Bill Hodgson's from Peterborough This Week and Mike Kawartha. If you've got some questions for Dr. Salvatierra, please go ahead. And I believe we also have Inspector Lyons on the line for questions for the Peterborough Police Service. So go ahead.
Thanks. Actually, don't have any questions today. Thank you.
Okay, that was fast. Great. So then let's move on to Matt Latour from Freak and Oldies Radio. Go ahead, Matt.
A question for Dr. Salvatierra, just about the 15th local death. Do you know if this was connected to any local outbreaks, or is that something you're able to disclose?
Well, I have not. I understand that the deceased individual has been identified, Matt, and I have not had a chance to speak with the family yet. So I am going to decline any further comments until I've had a chance to do that.
No worries. And my next question just had to do with, I saw yesterday Barbara Yaffe said something to the tune of, we could be, lockdown, shutdown, whatever you want to call it, until at least June. Is this something you think we should do, given that the provincial numbers are still kind of hovering around 3,000 cases a day?
I do think that we need to see those numbers come down before we open up. I don't want to see a repeat of what happened in February, especially now with the variants of concern. So unfortunately, I think until we see those numbers come down as a result of the stay at home as well as the immunization, I think we have to sit tight. What we don't want is a fourth wave. We want to come out of this and we want to stay out of it.
Perfect. And my last question just has to do with vaccination clinics, more specifically the one at the Evinrude Center here in Peterborough. Do you know what the capacity will be like there now that more people can book appointments? And I know some people can get them as early as next week if they're eligible this week.
Well, we do about 800 people a day at the Evinrude currently. We are looking, though, once we get more vaccine, Matt, we are looking at doubling that and potentially moving over to the ice pad space. So we're planning for that. And we're also looking at potentially extending the hours as well. So we have a great facility there, as everyone knows. And when we get more vaccine, we are going to ramp it up.
Perfect. And if you mentioned this earlier, my apologies. Is there any update on AstraZeneca yet, whether or not we'll be seeing more of those locally?
No, I'm afraid we have had no updates on future AstraZeneca supply. Typically, we get our allocations on the weekend. So we'll see what this weekend holds. And certainly if we learn anything, we'll share it with you.
Thank you. Have a good weekend.
Thanks.
Okay, thank you, Matt. Great. So let's hear from Paul Rellinger from Kawartha Now. If you've got questions for Dr. Salvatierra or the police service, please go ahead.
Thank you so much, Brittany. For Dr. Salvatierra, I too am quite astounded that there are people turning down the Moderna vaccine. I guess I just want to get a sense, is that from your knowledge of a small number of people? And do we have any knowledge as to the reasons why they're saying no to this? Or,
Paul, I'm dumbfounded, really, when I heard that there were 25 people yesterday at the Evinrude Center who turned around and walked out and gave up their chance to be immunized against COVID-19 when they learned we were using Moderna. I just can't believe it. So I have no idea why that's the case. And as I said earlier, I think people need to educate themselves and to take advantage of all the great materials that we've made available and that are available that speak to the effectiveness of both the messenger RNA vaccines. They are incredible vaccines. I mean, when you look at how effective they are, especially in older populations, they blow influenza vaccines out of the water. They are so powerful. So I can't understand why anyone would turn down a Moderna vaccine.
Yeah, very strange. Thank you for your answer. I wanted to talk about the case numbers across Ontario for yesterday are reported at 3166. That number, it's not in the 4,000s, but it seems to be staying relatively stable in the 3,000 range, low to high 2,000 range. I just want to get a sense from you that, we've got all these measures in place, and yet that number just doesn't seem to want to budge. It's very stubborn. And what are your thoughts on that? People watch these numbers every day as a barometer of whether things are getting better, and it doesn't seem, at least number-wise, they are.
We certainly aren't seeing the steep decline that we saw in the past out of wave 1 and wave 2. And I think it just reflects the variants of concern, Paul. I mean, most of our cases here are B117, and it is more transmissible. And I think it's just a little more, it's going to be more challenging to control it. And perhaps it's also reflecting that we're not getting the same limit of mobility. I mean, it's, you know, we're not going to shut this down unless we stop traveling and we stay home. And we should not be leaving home except for all, you know, those essential reasons. We should be exercising alone. So it's really no socialization right now. And so if we do that, we should be able to bring this under control, because we know from other jurisdictions, even those that had the variants of concern, that the public health measures work when they are applied. So we just need to hang in and be patient and do this for a little bit longer in order to get to the point where we can all enjoy a little more normalcy back.
And just one more question. I wanted to follow up on Matt's question regarding the lockdown and possible extension of that. I mean, I take it from your answer, that's certainly something you would be in favor of. But I wanted to get an idea or a sense from you. You know, we've had lockdowns prior and then things opened up. Have lessons been learned from the first go rounds with the lockdowns? And do you think those lessons have been heard loud and clear and may be applied this time around? When I say lessons, I'm talking about the government locking us down.
Well, I think, of course, I think there are lessons that can be learned. Hopefully they will be learned and applied. And one of the things I would like to say is that I would like to see schools reopen as soon as it is safe to do so. We know that kids need to be back in the classroom for their mental and emotional well-being. And we certainly saw last time here in Peterborough that we were able to open up the classrooms and allow students to go back as long as we kept everything else locked down. So if it means keeping the lockdown on longer in order to allow students back in the classroom, I certainly would be in favor of that.
Great, Dr. Salvatierra. Thanks so much. Have a good weekend.
Okay.
Thank you, Paul. Okay, so let's hear from Donelda Fraser, who's joining us from Havelock. Did you have any questions today, Donelda?
No questions today, thanks.
Okay, great. Then let's move on to our colleagues at the Peterborough Examiner. Joelle Kovacs, did you have some questions, or did you want me to hold off and ask you at the end?
So kind of you to ask if I'm awake. I have questions. Of course. I'm alert. I would love to ask. My first one for Dr. Salvatierra would be, remember when we talked a long time ago about drive-through vaccination clinics, potentially like at parking garages?
Yeah.
Is that something that's still under consideration for this summer? Can you tell me more about that?
Yes, we are still looking at drive-through, especially for second doses, Joelle, where because the issue with drive-through is that if you need to respond to someone who's having an adverse event in a car, it's a little more challenging. So we have safety reasons why we have been holding off, even though the weather is getting a little better. But certainly once we have good weather and once we're looking at second doses where people have had their first dose, they haven't had a reaction, they're good, we might be able to bring back the drive-through. I mean, we love the drive-through idea from both the staff, the immunizers who are doing it, and also from the perspective of residents, especially those who have mobility problems, because we saw even at the Evinrude, which is very accessible, but when you have people in walkers and people who use wheelchairs, the drive-through just makes makes the immunization so much more accessible and so much more pleasant. So we are in active consideration of being able to bring back drive-thrus.
Ooh, fantastic. Is there a preferred location for that, or is that not available, that information yet?
We have a few places we're looking at right now. So we haven't landed on one place, and it may be that we can do it in several places. So it's all under active consideration right now.
Wonderful. Thank you very much. Okay, on behalf of kids everywhere, is nasal spray going to be a thing for this vaccine and someday?
I have
Those
not.
eggs.
Yeah, I have not seen any clinical trials, at least any reports on clinical trials of a nasal vaccine, but that doesn't mean they're not happening. I would have to go and actually look to see whether any of the vaccines that are currently in development are being done as a nasal spray. So let me take a look at that, and I may have an answer for you.
Great. Someday I'll write about that, because I think some kids don't tolerate it as well as others and would love that. Okay, and I wonder if Inspector Lyons is there. Do you have any update on charges since last week? And that's all I have to ask.
Hi, Joelle. No, at this point, I don't have any update on charges. They are still in the process of trying to identify a couple of folk, but most definitely when that becomes available, it will be released. And again, as we prepare for this weekend, similar situation, we'll be looking at who's attending and trying to make sure we're making sure that people are safe, yet also imploring people to go home if they will. So
Thank you so very, very much. That helps, and that's all I have for today. Thanks, Brittany.
Okay, thank you very much, Joelle. So Reg Watson from the Examiner, any additional questions?
No, I'm fine. Joelle covered everything.
Okay, great. So let's now hear from our global news colleagues. Jessica Niznik, please go ahead.
I'm actually okay today. Thanks, Brittany.
Okay, you've got what you need. And then that brings us to Greg Davis.
I think he jumped off the line.
Oh, he's jumped off. Well, then I think we've gone through everybody who
I actually have more to say. I did do a quick search, Joelle, and interestingly enough, a team of virologists at the University of Ottawa have been awarded a grant to do research in developing a nasal spray vaccine. So looks like there is some research happening. I'm not sure at what stage of the trials they're at, but there are people looking at it.
Wonderful. That's a nice additional detail. Thank you so much.
Great. Thank you. Okay, well, then that brings us to the end of today's media briefing, and wishing all the mothers out there a happy Mother's Day this weekend. Please stay safe. Thank you so much for joining us, and take care. We'll see you back here on Tuesday. Bye-bye, everyone.
Thanks. Bye-bye.
Thanks, Britt.
Thank you.
thanks, Brittany.